अस्सलाम वालेकुम एवरीवन, वेलकम बैक टू माय यूट्यूब चैनल। आज की वीडियो में हम बात कर रहे हैं रीनल रिप्लेसमेंट थेरेपी। द एम ऑफ द रीनल रिप्लेसमेंट टेक्निक इज टू मिमिक द excretory function of normal kidney, include the excretion of nitrogenous waste product, maintenance of the normal electrolyte concentration, and maintenance of the normal extracellular volume. Hemodialysis blood from the patient is pumped through an array of semi-permeable membrane dialyzer which bring the blood into the close contact of dialysate. Plasma biochemistry changes toward that of diacylate due to the diffusion of the molecule down their concentration gradient. Access for hemodialysis. Adequate dialysis require a blood flow of at least 200 ml per minute. Most reliable long-term way of achieving this is surgical construction of an arteriovenous fistula using radial or brachial artery and cephalic vein. This result is distension of vein and thickening called arterialization of its wall, so that after 6 to 8 weeks large bore needle may be inserted to take blood to and from the dialysis machine. यहाँ पर जो है डायग्राम में फिस्टूला, वेन और आर्टरी सारा दिखाया हुआ भी है। देन हमारे पास आ जाता है फिस्टूला, AV फिस्टूला, फ्रीक्वेंसी एंड ड्यूरेशन. Frequency and duration of dialysis are adjusted to achieve the adequate removal of uromic metabolites and to avoid the excessive fluid overload between the dialysis session. An adult patient of average size between receive 4 to 5 hours treatment for 3 times a week. Complications of hemodialysis. Complications include hypotension during dialysis, anaphylactic reaction to drug, hot water syndrome, hemolytic reaction, air embolism, disequilibrium syndrome, rapid change in plasma osmolarity in hemodialysis, cause nausea, vomiting, restlessness, headache, hypertension, myoclonic, jerky seizure, and coma in severe cases due to cerebral edema. Dialysis, dementia, osteomalacia, and microcytic anemia due to albumin contamination of diacylate solution, hepatitis B, C, anoxia, complication of hyperonization. Peritoneal dialysis is utilize the peritoneal membrane as a semi-permeable membrane, avoiding the need for dialysis machine. A tube is inserted into peritoneal cavity through the anterior abdominal wall. Diacylate solution is run into the peritoneal cavity. Usually under the gravity, urea, creatinine, phosphate, and other uromic toxin pass into the diacylate down their concentration gradient. Excessive water come into peritoneal cavity by osmotic process. The fluid is changed regularly to repeat the process. Advantage: greater anatomy on patient part can be performed in hemodynamically on the patient part. Unstable patient because the patient are not suitable for hemodialysis, that itself cause hypertension. Decreased symptomatic swing observed in the hemodialysis. Poorly dialyzable compounds such as phosphate are better cleared, which permit less dietary restriction. Advantage: disadvantage: peritonitis less efficient than hemodialysis, not achieving the good biochemical control. Renal transplantation. Successful renal transplantation offers the potential for almost complete rehabilitation in end-stage renal failure. Donor may be living close relative and cadaveric patient with the brain death. Immunosuppression therapy is given for a long period to prevent the graft rejection with corticosteroid and cyclosporin, azathioprine, and tacrolimus. Complications: stenosis of arterial anastomosis, increased risk of infection, immunosuppression, risk for lymphoma, recurrence of disease, complication of immunosuppression, recurrence of the disease that cause renal failure such as Goodpasture syndrome and the focal segment glomerular necrosis. Corticosteroids supply sporin and azathioprine, bone marrow suppression and hypotoxicity. Tacrolimus also. यहाँ तक कोई भी इशू हो तो पूछ लें। अल्लाह हाफिज़।